How are you? My name is Michaela. I'll be your nurse today.
I'm Jane Doe.
Jane Doe, okay. Could you state your name and date of birth for me?
It's Jane Doe, and my date of birth is 4/2/1992.
Okay, I'm just checking for make sure that matches your armband. Okay, good. So what brings you in today, Jane Doe?
So I've been having some stress in my life, and it's been causing my heart to race a little bit,
Okay.
and then migraine headaches,
Okay.
which can be causes for my seizures.
Okay, alrighty. So we're gonna look into all of that. I'm gonna do an assessment. I'm gonna do a neurological assessment, so that'll help, assess your seizures and where some of that anxiety might be coming from and things like that. And I'm also gonna do an assessment and focus on your heart as well, okay? And we call it a cardiovascular assessment. Okay. I just got a few general questions. I know you probably get asked this every time you come to the hospital. But can you tell me the year? What year is it?
It's 2026.
2026, and who's the president?
Trump.
Alrighty, good. So I'm just gonna get a few vital signs as well before we start.
I also do have POTS.
Okay, you got POTS too. Alright, so we'll take two blood pressures, and one is going to be sitting, and then the next one is going to be standing.
Okay.
And what I'm just going to be looking at is, how if your blood pressure drops like significantly, they can explain like some dizziness you might have, and then look at your heart rate as well.
Okay.
Because I know it involves that tachycardia as well, and that means your heart rate is just beating really fast. So, alrighty, I'm gonna take your blood pressure. Let me just mark that down. Alright, so I got 120/80 for your sitting blood pressure.
Okay.
Could you stand up for me?
Sure.
Just nice and slow, not too fast. Alright, do you feel any dizziness or anything right now?
A little dizzy.
A little dizzy? Okay. So I see by your heart rate did jump up when you stood up. So now we're just gonna check your blood pressure, okay?
Okay.
And your oxygen looks good. Your temperature was 98.6, so that's normal. Alright. Alright, I got 90/30. Oh my goodness.
Yeah.
Alright, so I'm just gonna listen to your heart. You have some points on your heart that I'm gonna listen to, and I'm gonna listen to each one, okay?
Okay.
So you have the aortic, the pulmonic, the mitral, the earth point, and your mitral valve, okay?
Okay.
So we're just gonna listen to all of them. Okay. So I listened to your heart for a minute long. That's usually how long we listen. S1 and S2 is present. Didn't hear any murmurs or anything like that. So all that sounds good. The next thing I'm gonna check for is something called jugular vein distension, just like to see if you have any swelling, or that's like a sign of heart failure essentially, or maybe like fluid overload or something like that. So could you turn your neck to the left and right for me? Okay, I'm just gonna palpate your carotid artery as well. Okay, good. Just turn to the next side. Gonna do the same over here. Okay, everything looks good. Yeah. Okay, so let's go to the next. And then you can stick your arms out. I'm just looking for any swelling in your arms or anything like that. Okay, your arms look good. I'm just gonna feel no signs of pit edema or anything. And I'm gonna feel your pulses as well. Okay, your pulses are strong. Good.
Yes.
Alrighty. I'm just gonna do the same with your legs as well, and your pulses on your feet. Alright, good. Good. And then no signs of swelling in your feet as well, so that's good. Let's see. Just got my list to guide me. That's all.
That's alright.
All right, I'm just gonna check your capillary refill on your fingers. That just shows us that you have good blood flow. All right, right, good. I'm gonna do the same thing with your toes just to check that blood flow. All right, good. Everything's going good so far.
Good. Awesome.
What else can we look for? So you're perfusing good by the signs of your capillary refill. Have you had any chest pain or any pressure or anything like that?
No.
None of that. Okay. Any shortness of breath, maybe?
No.
Okay. Any fatigue with the
A little
pot?
fatigued, but
Anything like stops you from doing your daily activities
No.
or okay. Alrighty. Any I know you said some dizziness. Have you fainted or anything like that? Any syncope?
there are times that if I stand up way too quickly
Mm-hmm.
or move too quickly that I have fainted before. And then like when my seizures hit or whatnot,
Mhm.
afterwards I pass out completely then too.
Okay. Anything recent or when was your last syncope episode?
I actually passed out about, about 4 weeks ago.
4 weeks ago.
Mm-hmm.
Okay. So is that usually like the timeline or like or do you
Yeah, it
know
doesn't
when things are
happen.
coming?
It doesn't happen very often, but
Okay.
yeah.
All
Once in
right.
a blue moon.
Okay. Today everything's looking good, so I'm sorry that happened. But maybe we can develop some solutions to that. Okay. Alrighty, so that's it for your cardiovascular assessment. I'm gonna move into more of the neurological assessment. Okay. So you already answered the questions, which we call like the level of consciousness questions. So you're considered 804. So you're oriented to everything.
Yeah.
You have any questions?
It's new to me, but I think the doctor told me I had to increase my salt intake.
Right.
Which I don't really like salt, especially eating it. Do you have any suggestions for that?
Any suggestions of what you could eat to increase your salt?
Yes.
I would say eat
Maybe a drink or something.
a drink. I would say drink like Gatorade or something
Okay.
like that. Those usually have a lot of electrolytes in them.
Okay.
And, sodium is included in that. Yeah, I would say increase your electrolytes, your Gatorade,
Okay.
Gatorade.
Perfect.
And if you need to, you're oriented to everything.
Yeah.
Alrighty. So just by talking to you, no slurred speech, your speech is clear. You providing appropriate responses to me. And I'm gonna give you a word to remember, Duck. And I'm gonna ask you at the end of this assessment to repeat that to me, okay?
Okay.
So just keep that in your memory. You're able to follow commands. You stood up for me, you sat down, so we assessed that already. And I'm just gonna look at your pupils, okay? I'm gonna shine a bright light in your eye, but just look straight ahead, don't look at the light, okay?
Okay.
And I'm just gonna make sure they're reacting and that, your eyeballs are moving with the object. And
Alright.
everything. Okay, that one is round and it's reacting to light. Okay, round and reacting to light. Good. They both constricted when I put the light in them. So, okay. And then I'm just gonna ask you to follow this phone to each point. Okay.
Okay.
Alright. Great. Okay. Good. You did good. And then I'm just gonna test your strength in your hands. So
Okay.
if they're gripping equally, can you hold your arms out equally, no drifting or anything like that? Okay, good. And then I'm just gonna press your arms down, but don't let me push you, okay?
Okay.
Alright, strength is good. I'm gonna do the same thing. Alright, good. And then just grip my hands as hard as you can. Okay, good. Grips are equal. Okay, then I'm gonna have you close your eyes and I'm just gonna go up your arm and just tell me which arm you feel it on, okay?
My left. Or, sorry, my right.
Okay.
Left leg.
Okay, good. Great. And then I'm just gonna have you do a finger to nose test. So you're just gonna Do that? Okay, good. And then do the next one. The next one. Okay, good. And then we're gonna practice some balancing, okay? Make sure
Okay.
your balance is good. So I'm gonna have you stand up slowly. Alright, and so we're just gonna pick one leg up. Hold it for 5 seconds. 1, 2, 3, 4, 5. Okay, good. Next one. Ooh, mine's off too. Okay, 2, 3, 4, 5. Okay, good. The balance looking good. Facial symmetry. Could you smile for me? Okay, good. Stick your tongue out. Alright, so I don't notice any droopiness or drifting of your tongue or anything like that. Have you been swallowing food and liquid, okay?
Mhm.
Okay, I'm just getting you a drink of water. You're gonna swallow that for me, and I'm just gonna see if your gag reflexes are there or make sure you're not choking or anything.
Okay.
Here's your water. Okay, good, good. Eye movement is good. Any headaches or anything?
So I have been battling headaches. I do take some medications for them.
Mm-hmm.
But every now and then it does get to where I can't handle it and I have to go seek more help.
Okay. Okay. So the medication, has it like been effective at all or?
Recently, yes.
Yes. Okay.
About 3 weeks ago, I had a migraine headache that lasted over 2 weeks.
Okay. Okay. I know you said you do seek more help, so maybe we could get a consult to a one of our doctors, and we can look more into that. Okay.
Okay.
Okay. Any confusion or anything?
No.
Okay. What was your last seizure?
My last seizure was in January.
Okay, January. And are you taking meds for your seizures?
Yes, I take Keppra.
Keppra, okay. And is your Keppra dose kind of managing those seizures, or do you feel like we need to go up on the Keppra, or is it too strong? But is
No,
it doing good?
it's working.
Okay, all right. Good. All right, and that's all, okay? Thank
No
you.
problem.
You did really good today.
I appreciate it.
How about?